In recent years, youth, families, providers, and child-serving systems, such as mental health, child welfare, Medicaid, juvenile justice, education, and primary care, have recognized the importance of developing, expanding, and sustaining efforts to become trauma-informed. Most states are developing comprehensive policies, practices, and services to meet the needs of children, youth, and their families affected by trauma, including helping to prevent re-traumatization. In the following video, you will hear from individuals immersed in this work from across the country who urge decision makers to take action and become trauma-informed. Action is needed at the family, youth, provider, local, state, and advocacy levels.
Trauma-informed care is about recognizing what happened, what did it do, and what can we do to help never erase it, but make it so that it's something manageable and that I can grow from.
This is a public health emergency that is kind of being ignored.
This is a #1 priority. With everything that's going on in the country today and all of the things that are happening in the communities today, a lot of children are experiencing a lot of traumas. I mean, from bullying to low economic status, there's a lot of things that are affecting them, and the care that they receive needs to be very well informed of that.
I think it's a way to appreciate that what might be easy for me to deal with might be extraordinarily challenging and complicated for someone else.
And I think it's becoming clearer that unless we understand the trauma history that a child and family might come to services with, we do run the risk of addressing the wrong cause for some of the things that represent symptoms and behaviors and the needs of the families.
We know that when kids experience traumatic stress, it sort of triggers an alarm system in the brain and the body. We've all experienced that. We're in a stressful situation, that fight, flight, freeze response. That alarm system in the brain, shuts down things that aren't necessary when you're in a dangerous situation. One of those things that shuts down is the ability to learn.
And the more that educators are able to recognize that children's behavior is a developmental response to their past experience, the more that they can move away from a punitive approach and rather begin to open to understanding, to be able to be present and available.
Pretty much everything they've experienced that have brought them to our doorstep is trauma on some level. So we would be remiss not to go in the direction of trauma-informed care, better educate ourselves and our staff to better help the youth and the families.
Right now, the major thing is to make sure that we bring all parties that touch children in the child welfare system and all children, that is done in a way that's that complements each other and not repeating. And so family members don't have to we're not asking them the same questions over and over again and re-traumatizing them.
How and what can we do to be able to have this lens of trauma?
Trainings are important to get that information out there, but really you need coaching on implementation, making sure that you are in connection with that information about trauma on a regular basis.
We could go change our training program or change something in a policy manual. It's called process change. But it's only when it happens at the performance level, when the individual within the system behave in the way that you desire, that change really occurs, that it matters to the families.
You've heard the cliche, it takes a village, and it definitely takes a village to raise a traumatized child.
When a child deals with an issue or a trauma, the whole family goes through that trauma.
As hard as it is, it's also very rewarding when you look at a child and you have that sense that they're going to be okay.
I'd just like to tell others, don't give up. There's always hope, and know that there are people out there who care, and you're not alone.
This video provides a very brief introduction to a comprehensive web-based, video-enhanced resource tool that will augment ongoing efforts at the state and local levels to help organizations become more trauma-informed. This includes strategies to build capacity for a workforce that is trained in evidence-based treatments to address trauma. Watch for announcements for this online resource tool that will be available in August of 2014 on the Georgetown University website.